All right, nice to have you on here today. You are most welcome to my channel. Subscribe if you haven't. Meanwhile, my name is Chinyere Ojike and I am a healthcare assistant here in the UK. I have worked in over 10 different healthcare settings, ranging from the hospital, the care home, the domiciliary homes, and different homes that I shall be sharing with you in this very video. So please subscribe to my channel and stay tuned for the details. Yes, so if you are looking to move to the UK to take up a job in a healthcare setting as a healthcare assistant, do not be scared. In fact, the roles of a healthcare assistant in this very country, they are just very simple and similar to the everyday roles we do in our homes, especially if you have aged parents, even sisters or brothers who are poorly at times. We are always there supporting them, helping them. It's just that in this part of the world, this very role or the roles of a healthcare assistant is something you do and you get paid for it. But back home, where I am coming from, we do this job every day and we get nothing for it. Though it is not really necessary, we're looking to get paid for assisting, supporting, emotionally being there for our loved ones when they are done or when they needed us, especially our aged parents. But in this part of the world, it's totally different because of cultural variations and belief system. So today, I will be sharing with you the different places, where you can be working, different settings where a healthcare assistant is expected to work in the UK and the roles of a healthcare assistant. So number one, you can be working in a place like hospital. A healthcare assistant work in the hospital alongside with the nurses, the doctors, the midwives, the physiotherapists. In fact, virtually in every department in the hospital exists a healthcare assistant supporting the roles of the professionals there. So what are your roles if you are working in a hospital setting as a healthcare assistant? Basically, you assist the nurses in doing their job, and you assist the patients. Sometimes it is almost similar to the work those who work in the nursing homes do, but it is not as tedious, let me just use that word, as what you do when you are working in the nursing home. I am yet to come to that. So when you work in the hospital, you are trained to do observations, taking vital signs, checking the temperature, the heartbeat, the getting one beats, all the vital signs on a patient, and you assist the patient with certain levels of their personal care. Honestly, I've worked in about 6 different hospitals in the past. There's never been a time a patient has a full bath, but at least you help them when they want to have a wash with towel, clean their face and all that stuff. And you can also assist the patient when there is a need for movement, moving from one point to the other, especially the ones that cannot move properly. And there are facilities provided for you to do this. When a patient wants to move from the bed to a chair, to his or her wheelchair, you can use hoist to move this patient. You also support in rolling patients around. You also support in moving patients from one department to a different one, possibly from the ward, from theater to the ward, from the ward to an X-ray department, to different departments in the hospital. You support in moving these patients around. And basically, when it comes to some of all these personal cares they do at the hospitals, minor personal cares they do for patients at the hospitals, a nurse must assist you to do that. It is not something you do just you alone, unless there are 2 of you working and available to support that patient. Especially when it comes to rolling a patient, a nurse must be there to do the personal care with you. So this is just the job of a healthcare assistant in a hospital setting. And a healthcare assistant can also work in a nursing home. What is a nursing home in this part of the world? Nursing homes are places where you have aged people who do not want to be, receiving personal cares or receiving cares in their homes. And some of them are sort of sick, with, old age sicknesses like dementia and diabetes. Name all the old age sicknesses that come around when people are aging, so they basically need, support. And basically, what the role of a healthcare assistant that is prominent at the nursing home is personal care. When you have to provide personal care to our clients, personal care such as you washing the patient, as giving the patient a full shower if the need be, changing clothes, making their beds, helping them with their food, doing laundry, cleaning, just basically helping them with their day-to-day personal cares as they would have if they were in their homes. So number 3 is having to work in the residential home. These are residents, people living in a designated homes. Basically, some of them are mostly independent. That is why you call them residents. So the healthcare assistant job to these very people are totally minor and not something very much, I don't want to use the word difficult, it's quite different from the healthcare assistant job role or description when you are working in the nursing home. Because these people, they are independent. Quite a large number of them are independent. They can do their thing, just minor assistance you need. Helping them to walk into the bathroom to take their shower. A lot of them can make their food. A lot of them can walk to the dining and sit down and have their breakfast. Just minor support. Can you give me this? Can you? Some of them don't even like asking you. They just wanted somebody to be there for them in case of any emergency. They absolutely do their things on their own. And maybe they want to go to town for a sightseeing, for shopping. They need you to follow them to town center. So it's basically minor compared to what you do in the nursing home. Next is the home care. It has to do with you going to people's home. These are people who, for one reason or the other, they don't want to go to the nursing homes or residential homes. And meanwhile, a lot of them are also independent. They just want you to come in there and support them, walk around in their house, do their daily routine, just little or no support. I remember doing a support work in someone's home in the past. Those years, I've once explained it here. Honestly, the wife is the main carer. I just relieve her once in a week for her to go to town and have a drink with her grown-up kids. So basically, when I go in that home, everything is done for me. I do that job, or I did that job just 6 hours once in a week. So I go in as from 11 o'clock, finish at 5 p.m. All I did was just to sit down, watch television, different programs on TV with my client. Then, when he wanted coffee, he would say, Francisca, can you make me a cup of coffee, please? And I would go to the kitchen, make him a cup of coffee, make my own. We sit down, we chat. When it is lunchtime, I go to the fridge, grab his lunch, grab his lunch, warm it in the microwave, give to him. He enjoys it, finish. 5 o'clock, I got my money, I go home. So home support worker or going to people's home to work is totally different. It requires nothing much compared to that of the nursing homes. Another setting where a healthcare assistant can work is in assisted living homes, living residential homes, places where they have people with disabilities, different disabilities. They have different ranges, like where I am currently working, people with disabilities. And basically my role as a healthcare assistant there is totally different and sort of much more tedious compared to the healthcare assistant job I have done in the past. Yes, that's just the truth, because I've never done the kind of job I am currently doing as a healthcare assistant. So there's a whole lot when you are working with people with disability, especially people who 100% cannot support themselves in any way. Just think about it. Have the picture of what it is. Even feeding, you have to do feeding. You have to support them with feeding. Though some residents are also independent, just little support, but a couple of them are not. So this is basically what it is when you are working in a disability home. Just be ready to provide 80% of personal care or care role to the residents living in such places. Another place is the prison. Working as a healthcare assistant in the prison setting is totally different. I haven't been there. I haven't worked there. So I wouldn't say precisely what they do. But bear in mind that healthcare assistant role is almost similar in every setting of a healthcare job. Yes, be it the hospital, be it the nursing home, residential home. Another one is the living care. When you are working as a living carer, you go into someone's home to live with a person. You might be spending a period of 2 weeks living with the person you are caring for. But know it that they provide an accommodation for you, a separate room for you. Feeding might be included for you, depending on your job description and the benefits of you taking up such a job. But a living carer earns honestly far much higher than somebody who goes in and who goes to work and come back every day. For instance, a living carer might be earning about £1,000 just for 2 weeks of staying in someone's house day and night. But you going to work and coming back every day, that is the amount you might be earning at the end of the month. Do you get the difference? Because it's a lot going to live with somebody for 2 weeks, 1 week, depending on the agreement on ground, but then you still have your break, you still have your time off. This kind of job, living carer's job, it's absolutely going to be suitable for someone who doesn't have a family, a single person, not even a student, because you need to be going to school. All right, so basically, working in a hospital, working in the nursing home, residential home, assisted living home, the prison, living carer's job, all these jobs are interwoven, they are interrelated. So, but then in a hospital setting, it's totally different. It's just that they require you to be on your feet 24/7 while you are at work. Though on a night shift, it's also different, but then you have to stay awake. But in the nursing homes, doing a night shift there is also different. After your first 3 hours, once you are done with your personal care, with your role for the night, can do like this a little bit for those who do night shift, So it's absolutely different depending on the clients, depending on the service user, depending on the resident, and depending in the house, in the home, in the residential care where you are working. These are just the variations. All right, so feel free, keep on applying to come over here to take up this job. It's a noble profession. Yes, you assisting people to live a happy life, to live the life they want to live. It's something that is, honorable. It is something that is fulfilling. Yes, it could have been you. It could have been anyone. We're all gonna age. Yeah. So that's it for today. Subscribe to my channel if you haven't. Thank you for stopping by. Bye for now.